Hello, everybody. This is Veronica Brockwell, and welcome to V Talks. Today's topic, GLP-1 weight loss drugs. I have so many friends that have started taking these drugs, celebrities, influencers, they're everywhere. But what's really the story behind these drugs? I've got Dr. Manuel Correa on the show today. He is an ER doctor, and you're going to want to hear what he has to say about these drugs. And more importantly, you want to learn, are these drugs right for you? So please welcome to the V Talks, Dr. Manuel Correa.
How are you? Nice to see you,
How
lady.
how are you, sir? Very good to
Fantastic.
see you. So today we're going to talk about the GLP-1 weight loss drugs. But before we jump into the topic, can you tell me a little bit about yourself?
My name is Manuel Correa. I'm a board certified emergency room physician. I've been practicing for 25 years in the city of Fall River as well as Wareham. I initially got my medical degree in New Jersey and trained in Philadelphia, and now I work and live in this beautiful New England area.
Thank you so much for coming on the show and talking to us about this. As an emergency room doctor, you are on the front lines of what's going on. Can you tell us a little bit about what you're seeing in the ER in regards to these drugs?
Yeah, and just to preface this, I'm in the ER, so whenever there is a problem, that's where people are going to go. They're going to go to the ER. So I'm going to see the complications. I'm going to see the problems. That's not to say that everybody will experience these complications, but this is what I'm seeing with folks that have come in with some serious side effects from the GLPs, which are basically glucagon-like peptides.
Okay.
So what I see mostly is gastroparesis, so nausea and vomiting, abdominal pain, and again, that goes back towards the mechanism of how the drug works. And we'll get into that a little later. I'm also seeing pancreatitis, which is inflammation of the pancreas, which can be quite painful, as well as some folks that are presenting with dehydration, acute renal failure. Um, Again, to say that they're specifically linked to the drug, I can't say that, but I can tell you these are folks that were otherwise healthy and had been on the drugs for several months and then presented with these symptoms and some of these abnormal lab findings, including elevated lipases from pancreatitis, elevated creatinine levels from acute renal insufficiency, as well as other symptoms, which include pretty significant constipation, as well as abdominal pain, nausea, and vomiting.
Okay, as long as you've been in the ER looking at these things, I'm sure you've been dealing with the fallout from these medications for a while, but was there a particular case that came about that made you think, "Are these drugs really safe?"
Yeah, I had two cases of pancreatitis wherein the pancreas gets inflamed, and that's one of the organ systems that the drug works on. It basically helps to stimulate insulin and modulate glucose levels within the body, and the pancreas is largely responsible for that. So these folks are coming in with mid-epigastric tenderness and pain, and presenting with elevated lipase levels and inflammation of the pancreas. That was concerning to me that we would see drugs that would cause this particular problem in somebody who otherwise doesn't have either a drinking history or pancreas issues from the past. Another thing that I've seen that I find quite concerning, and this is right now, I'd say I'd seen maybe about 4 or 5 cases of folks that have had bumps in their creatinine levels, which is your renal function. So, and one individual had a creatinine that went from perfectly normal, which is 1, to
Mhm.
3.9 within a matter of 3 months. Now, she wasn't on any other drugs. She
Yeah.
presented with weakness and fatigue to the emergency department. Also, was complaining of abdominal pain. And when we did her laboratories, we found that her creatinine was markedly elevated, and she wasn't on any other drugs. She didn't have any other past medical history, didn't have diabetes, didn't have hypertension, didn't have a known history of renal disease. I
Yeah.
won't say for sure that I'm linking the drug to that, but I have seen on more than one occasion where folks come in and have elevated creatinine levels, which may be related to dehydration or something we call prerenal azotemia, which might be from the fact that not only you're not eating, but you're not drinking.
So, when you're in the ER and you are interviewing these patients, do you feel that they're being educated by the provider on the side effect or
I,
not?
I think, again, not that I had full discussions about their prior education of the drug, but I think it to that point that there are a lot of people that are getting these drugs from different sources and getting variable education on what these drugs really are and how to take them. Because they should be taken in a very careful fashion. It's not something where you go to some online source, have some online doctor say, "Here you go," and then start
Mhm.
taking the medication. That might certainly be a cheaper way to do it, but certainly not the safest way to do it. And I think that again, there isn't a standard protocol that everybody follows. Now, I think maybe some of the more advanced weight loss clinics that do gastric bypass and things and incorporate this drug into their system are probably more proficient at explaining to people some of the side effects and what they should be doing as far as the taking the drug and how to properly increase the dosage as they go along. I think that's probably a safer way to do it. If I were to do it, that's probably the way I would do it. But because the drug is very expensive, it can cost up to $1,200 a month.
Yeah.
People find cheaper alternatives, and some of these cheaper alternatives are really doing online surveys from an online physician who then prescribes it for you. There are compounding agencies that pharmacies that will do the active ingredient compound and send that to you. Again, there are some places you go to that maybe let various med spas, let's say, that might offer this, and they may have a good grasp on how to do it, but then again, maybe they don't. Eh, Again, there isn't a uniform um, approach to this, I think, and I think that's what makes it somewhat scary because it is so variable.
Let's break it down a little bit more here. And we can talk about the different brands as well that you're going to see these GLP-1 drugs, right? We've got
Right.
Ozempic is a popular one, right? Another one,
So
what?
Ozempic and Wegovy are semaglutide. So basically,
Okay.
that's the generic compound name. There is liraglutide, which is Victoza. A lot of folks may be on that for their diabetic medication.
Mhm.
Trulicity, otherwise
Mhm.
known as dulaglutide. And one of the more recent ones is Vieta. So again, there's a number of companies that have formed these GLP-1 agonists, and they come under different names, but
Yep.
essentially work in the same fashion.
Mhm. So, what are these drugs actually doing inside your body when you start taking them?
So what they do and why they were initially developed is they help to regulate glucose levels within the body
Mhm.
via stimulation of insulin from the pancreas.
Right.
So that's the main function of why the drug works in diabetics. But it also has other effects on the body, which include slowing of digestion, which can slow the amount of a food bolus through the stomach. So it makes it last longer, essentially. So you feel fuller longer.
Mhm.
So it slows that transit. And it also works centrally on the brain, on the hypothalamus, because that particular hormone will trigger the fact that you feel satiated, that you're done with eating, you're full. So it works on 3 different ways, 3 different levels on the
Mhm.
pancreas, on the intestinal system, and on the brain.
So I was doing a little bit of research on this, obviously, and I was reading that it causes stomach paralysis.
Yeah, we
Well,
refer to that as gastroparesis, in
okay,
medicine, so
that was scary.
th
So can
that's
you
part of the
explain?
function of how it works. That's
Can,
part of why it works. It slows transit of food through the stomach. It makes you feel fuller longer, and one meal, whereas before you might have digested it within a few hours, is now taking you 5, 6, 7 hours.
but I was
Um
reading these things. This can be permanent. Like, it's not there are times when it's not even reversible. Is that true, or is that
I
propaganda?
haven't
I don't
seen that
mm,
in my personal practice in the
okay.
ER, but I have read also along the lines where folks are
Mhm.
having a hard time just getting back their normal appetite and having persistent abdominal pain and discomfort even after stopping the drug. Again, how frequent that is, I don't know. And that's the other thing about this drug. We don't know. This drug is it's been on the market for diabetic treatment since 2005. So yes, it's been on the market for over 20 years. I think that we still have we only had a certain subset of people that were taking it. Now we have a much larger cohort of people that are taking this drug. I
There
think
are also too, like, there it was never intended, I don't believe, for weight loss for a person that only needs to lose 20 pounds, right?
yeah,
Or 10
I think
pounds.
it was a beneficial side effect that they found when they initially, had the drug designed for diabetics. Interestingly, diabetics, when they get treated, they're using insulin, and the
Yeah.
insulin many times will make them heavier. It stores a lot of the, glucose within the body into triglycerides and fat deposits and such. So, the more insulin you were using, the bigger you were getting. So that was a problem. Now, how this drug worked, it did stimulate insulin, but it also worked on two other features, which is again, the transit of food through the stomach as well as on the brain to make you feel full. So, unlike just strict insulin, this was stimulating insulin without necessarily having some of the issues associated with insulin causing you to get heavier with
Mhm.
the deposit of more fat. So this was it seemed like a win for diabetics. They were getting insulin control, they were controlling their sugars, and they were not getting heavy. They were finding these people were losing weight. So much so that they were losing 10 to 15% of their body weight within a year.
And that includes muscle.
Yes, at some point, yes,
Mhm.
because as long you're on this drug, and I've seen people lose incredible amount of weight, and it's impressive. It's very impressive. It's alluring. I actually looked into the drug for myself because I would love to lose 15, 20 pounds,
Yeah.
maybe.
Summer's coming.
And yeah, and
Yeah.
as I took a deep dive into it, I came up on the no end of it because of some of these. I think that when you talk about risk and benefit analysis and somebody that's diabetic, that's overweight, that has hypertension, they have definitive risks. Coronary
Yeah.
artery disease, stroke development. I see that all the time too. And those are not good features, obviously, of being a diabetic or being hypertensive. So I definitely see a benefit in those folks that have underlying disease processes that would benefit on a risk analysis from decreasing their weight as well as regulating their sugar. Now, to your point, there are a lot of people that are doing this. I just want to lose 10 pounds,
Right.
15 pounds. I just
Yeah.
want to just jumpstart things, maybe kind
Yeah.
of get the ball rolling. So I don't know if that was really the intent of the drug, but that's what it's become because that's a big moneymaker. That's a big indication for a lot of people.
1,200 a month per
Well,
person, you
now
know?
you can cut that cost down to probably about $300 a month if you go through a compounding agency and just pick up the active ingredients. Now, that's a slippery slope because again, they didn't do these large trials and studies to prove efficacy and side effects on these compounding agencies. They did it on these specific drugs and they followed very strict protocols and they educated their people that were in these programs so that they would diminish the number of side effects. We've taken something that had a very interesting benefit and now we've expanded it to a larger group of people. And you have to wonder really if we've lost some of that benefit and maybe increased some of the risk.
I've also read and seen on social media these young girls that are talking about being diagnosed with osteoporosis in their 20s. Have you heard about this or seen anything like this in the emergency room?
No, not I have not. Again, whether there's a correlation there or not, again, remains to be seen. One of the things that I have seen is muscle loss in folks that have been on it for some longer period of time, maybe over a year. And what happens is now that your body doesn't have those fat reserves that it used to have where it could pick up energy and you're now regulating the sugars by stimulating insulin, and your body still needs to function. It
Yeah.
still is a source of energy, and the next source of energy down the line is protein. It's there. It's going to hit your muscles. I think if you're on these drugs, you have to be very wary of your protein intake and how much you're taking in, so you can supplement some of that expected muscle loss as your body now converts to other sources of energy. And unfortunately, protein breakdown is one of them. So
So, in your opinion, who should be taking these drugs?
I think the intended audience is who should be taking it. I think folks that have other risk factors, diabetes, hypertension, and obesity are probably the prime candidates for something like this. A lot of those people are usually being seen by endocrinologists or internists that know what they're doing, and
Sure.
they're going to be educated on the drug itself in a more efficient way, I think. So that I think is the real intended audience. Now, somebody that just wants to drop 10 to 15 pounds, I think is going to potentially be the wrong audience. There's probably better ways to lose 10 to 15.
And your suggestion would be?
For those folks, their suggestions as old as time. It's diet, exercise, and watching what you eat. Again,
Sure.
really basic stuff, and it's not easy to follow. I'm not thin by any means, but
You work a lot. You're keeping us healthy in the ER because you work two emergency rooms, right?
yep, I work in we're
Yeah.
contracted for two different departments in the Massachusetts.
Yeah.
So
Yeah. So diet and exercise the old-fashioned way, right?
yeah, this whole process that's going on now is somewhat reminiscent to me of the whole fen craze back in the
Oh,
80s.
right.
And
Yes.
that was the hot topic at the time. And lots
Gosh,
of people
remember?
were losing tons and tons of weight. And until things went bad, until people started developing primary uh, pulmonary hypertension and intracranial hemorrhages and developing significant deadly side effects from being on fen combo. Again, I'm not saying this is Fen all over again, but history will repeat itself, and I'm wondering if there's some element of that, nowadays with this new hot drug.
It's interesting. Actually you also have a day spa and,
Yeah,
yeah, a
medical stuff.
medical spa, and you don't prescribe these drugs.
No, I've been asked
No.
by a lot of my clients,
Yeah.
and patients to put them on it because they wanted a doctor to start them on this weight loss, and I told them all no,
Yeah.
simply because as I dug into it and really looked into the side effects, my own personal experience in the ER department, I came up with the conclusion that it's not something I want to offer at my med spa. I think it could be offered in a better setting than a med spa. And yeah, my marketing agency person was like, "You're crazy. You can bring all these new people in." I really think you need to go by your gut instinct and say, gee, this is either something that's positive or not positive. And I think in the med spa setting, I didn't particularly, for my own, I'm not saying any other med spa shouldn't be doing it. I'm just
Right,
saying
of course.
my own particular med spa decided that this was not something we were going to offer.
Yeah. What's one thing that every single person should know before they start taking these medications?
Yeah, I think you need to understand how the medication works and some of the side effects that are going to be associated with them. And they're not maybe side effects; they're pretty persistent side effects. These are
Yeah.
things I see that just about everybody that's on it had some type of gastroparesis or nausea or
Mhm.
bloating or constipation. This is a common side effect, not an uncommon side effect. A lot of people say, "Oh yeah, every drug has side effects," and that's not going to happen to me. Okay. And I think they need to realize that the drug itself is something that you don't just take it, lose your 10 pounds, and then you're done. As soon as you stop taking it, that hunger will come back and that weight will come back. The
Sure. Yeah.
Yeah, this is not a one and done thing. This is potentially a lifetime commitment to trying to maintain that weight on this drug. So you need to decide for yourself, am I going to use this as the way that I'm going to get to my goal weight? And if so, am I going to commit to this drug for the rest of my life? People say, no, I'll just change course in the middle of it. And once I get to that goal weight, then my life's gonna change altogether. All my habits that I had
Yeah, not
like, so
learning anything because 'cause you're not hungry.
right, that's the argument, then just start there. Start with all the things you were gonna do to get and maintain that weight, because losing the weight's one thing, maintaining it is a completely other thing. So, I think folks should really understand that they may be committing themselves to a lifelong drug in reference to what indication, which would be weight loss.
And we're not having this conversation to instill fear in everyone. I think
No.
we just want people to be educated on what they're taking, because I really feel that maybe they're not always getting that when they start taking these medications. And to your point, probably because a lot of them might be getting them online because they're less expensive. I can't say. I don't know. I've never really attempted to take them. Though like you, I did think about it for 5
Yeah,
seconds.
I mean,
Of
it's
course,
enormous. Yeah, I
yeah,
mean, who
you're like,
doesn't wanna drop
"Wow."
30, 40 pounds
I
anymore?
I know, right? I'm like, "Oh, 10 pounds to my goal weight. This will be easy peasy," you know? Yeah, so but after doing the research, and then when I reached out to you and asked you about the drugs, and I started, talking to some of my friends that were on it. I have one friend who was very sick, and she had pancreatitis. She was very sick and got off of it quite quickly, but she fell into it. It's like you said, it's alluring.
Oh,
Summer's
yeah.
coming. But there are other options too. Yes, there are other options too.
I think you
And
gotta go. Yeah.
they do have their place for people.
Yeah.
There are people that will benefit from them, I
Yeah,
think.
I don't wanna say that the drug has no place in medicine. I think it does. It was a revolutionary way of treating diabetes for sure. And again, it may still very well turn out to be a fantastic drug for people that have diabetes and hypertension. And here's the other thing that's craze has brought about is that it has increased the demand for it, so that people that actually need the drug for higher risk disease processes like diabetes and hypertension and obesity are having a hard time finding the drug in order to get treatment for themselves. So there's that aspect of an entire population just seeking this drug and making it very difficult for the folks that really need it sometimes.
Yeah, 100%. Thank you so much.
You're welcome
I am very grateful that you came on the podcast and
to be
talked
here.
about what you were saying. And maybe we'll have you on again. If we want to hit another topic, I'd love to have you.
All right. I'd love to be on.
And have a wonderful day,
You
Dr.
too.
Kriya. All right.
Take
Take
care.
care.
I'll see you.
All right.
Take care.
Bye. All right, everybody. Thank you so much for tuning in and learning about what Dr. Kriya had to say about the GLP-1 weight loss drugs. If you're considering taking them, just do your research. It's very important that you know what you're getting yourself into. If you have a friend who's interested in taking the drug or wants to learn more, please forward this podcast to them and just make sure that they have the information they need before they start on these things. All right, everybody. Thank you so much, and we'll be back with another episode soon. Bye.